Hi, Kirsten.
Hi, Andy.
Thanks so much for agreeing to this interview. Can you introduce yourself first, please?
Yep, sure. Hi, I'm Kirsten Alderson, and I'm the CEO of Suffolk Family Carers.
Thank you. Do you want to say something very briefly about Suffolk Family Carers as well?
It's a fantastic organisation. We support family carers of all ages, from 5 to 105 years old, across the whole of Suffolk. And family carers being someone who's looking after somebody with a long-term condition or a disability. It could be anything. It could be a substance misuse issue. And we're supporting the carers, so to enable them to have a bit of time to themselves, a break, some respite, and just basically be able to be carers, but have a life of their own as well.
Thank you. So I've got 4 questions for you, and I'm asking one at a time. This is the first one. How are you looking after yourself, and how are you supporting your teams?
Okay, that's a good question. I like to be kept busy most of the time, so I went into this pandemic with the idea that I'd just do loads of stuff, which I think a lot of people did. And it didn't take very long to realise that you can't just do that. So I probably was the worst advert in myself for how you should be looking after yourself, because I was just thinking, I don't want to be bored. That would be awful. Let's just, So I did far too much online meetings and work, and found that my eyes were swivelling in my head by about 2 weeks in, and realised that I hadn't taken the advice that we were giving to our own teams at work, which was to look after yourself. Make sure that you were putting self-care above everything else, actually, including work, really. You've got to keep well, otherwise you'll end up poorly and just not able to do anything. So I really did have a sit down and a rethink. And I spent a lot of time now when the sun's shining outside, either in the garden, which I'm lucky enough to have, or taking the dogs for a walk, or even just lying around reading a book and not feeling guilty about it, because it's so important to do. And it's a message that we've been giving to teams at Suffolk Family Carers from day one of this pandemic, almost like an objective to make it really clear. We want you to look after yourselves as part of what you do every day. Even if it's one day you think, I've woken up and I can't cope with today, today's awful, I just want to lie in bed and read my book and drink some tea and maybe watch some rubbish telly, fine, as long as you're keeping well and as long as you're doing the things that make you feel okay, and then you can get up and do some work tomorrow. So we've been really flexible. I mean, that's the sort of organisation we are anyway. We are a caring organisation, and we try to live up to that. But we've also provided some support as well. We've got our HR department, they're really hot on wellbeing, and they send out emails every Wednesday, Wellbeing Wednesday, with lots of fun stuff, but advice. And we keep connecting with people. We've got our team meetings, but we also have coffee mornings. We've had quizzes. We've done a lot of fun stuff, encouraging people just to connect with their teammates and have that chat that you would quite often have on a Monday morning anyway. What did you do on the weekend? And, how's your dog? That sort of thing. So all of that is being encouraged. But seriously, we also do the serious stuff too. Suffolk Mind provided some really great training for staff about wellbeing, and we booked a whole session for our team, and there are more people who want to do it, so we'll continue to book that sort of thing. And we've got an employee assistance programme that we signed up to quite a while ago, and I know people are using that as well quite regularly. So we try to do as much as we can in that sphere, because for me, as I said before, it is the number one priority. I want to be able to see really well teams when we eventually get back to work. So that's what we're encouraging.
It's good to hear that you reflected about yourself, because that really helps you focus about what you're doing for others as well.
That's right, yeah.
Thanks, Kirsten. So second question is this. What is the experience of COVID been like for family carers? And very importantly, has Suffolk Family Carers done, what has it done to adapt to this?
Yeah, obviously carers are all individuals. They're all having their individual experiences, but there are some themes that we have picked up. and probably most of them aren't that surprising. But the one that really surprised me and made me chuckle a little bit, although it's not actually funny, but it was said in jest by a number of people, which was, what's new? We always do this. You know, we live like it's COVID-19 all the time. You know, we get on with it. We don't get a great deal of support. We feel quite isolated most of the time, especially those people who care for somebody who maybe is non-communicative, or the caring role is 24/7. So it's kind of, we did have some conversations in the early days, like, yeah, what's new? We've always done this. We're used to it. We're good at it even, which of course carers are, but it shouldn't have to be, I guess. But that sort of real stoicism, I don't think it lasts. Even the most stoic carer, this situation has been really tough. I think it's been tough on all of us, but it's tough on carers because even if you were getting a tiny bit of support, quite often people found that stopped in COVID. If your neighbour used to pop in and give you a couple of hours so you could pop to the shops, they might not feel able to. Or if you were shielding, or the person you cared for was in the vulnerable group, you might say, don't come anymore. And so that little bit of support that people might have been getting kind of disappeared for people. And then what we see anxieties about COVID, about the illness. Actually, some people reporting they feel depressed now. But the underlying factor for everybody is about the isolation and the loneliness. And actually, in some respects, that's something we can help with at Suffolk Family Carers. We already had a service called Talk and Support, which is run by volunteers, which is about ringing people very regularly, maybe once a week or once every 2 weeks. And it was really specifically for those carers who were very isolated, maybe very rural, or maybe they were caring for someone who didn't talk anymore, maybe dementia or some other illness that meant they didn't have much communication. So we were able to actually sign up quite a lot of new volunteers to expand that service, because suddenly we had a flood of people come in saying they were in that situation now. So that was really great to be able to tackle that. We knew how to do it. We already did it. We just expanded. And the other thing we were able to do was refocus some of our teams. The ones that used to do stuff that required them being out in the community that couldn't actually do that anymore, we could refocus them. And we went through our list of 14,000 carers that we've got registered with us. Yeah, it's loads. And we identified 1,500 who were in the vulnerable group or who are caring for someone very vulnerable. And we've just been ringing them off our own bat to say, how are you? And do a welfare check as much as anything, but also just have a conversation, and also to provide emotional support. And if there was a need, to make sure we got them that need met. And I feel really, really pleased that we did that. I'm really proud of the teams that came up with that straight away, because the feedback we've had is kind of like, I didn't think I need anything. I didn't think there was anything, but wow, thank you so much for ringing. Just made me feel that people were thinking about me, and it made me really think, if I needed some help, it was there. So we've been able to do stuff like that. We've moved all our services online. There's not actually a great deal we're not doing anymore, apart from that physical in the same room, sort of fun stuff, really. But we're open to people giving us suggestions as well. One family carer got in touch a couple of weeks ago and said, actually, what I really miss is just having a coffee morning with people. So we've had an online coffee morning, and carers signed up, and it was quite a laugh, really. So we've done what we can, but we're listening to people, and if there's more that we can do, we'll do it.
That was what you started off talking about, was reflected at the Thinking Differently event that you spoke at, Kirsten, recently. And the comment was at the time, yes, we're all in that same situation, but at some point we're not going to be in that situation anymore. Whereas if you're a carer, you don't have that option. And it's good to hear how you've adapted as well. You've almost become that neighbour that can't visit them, but you're an informed and well-connected neighbour, and you're listening to them as well and adapting further, which is really good to know. Thanks, Kirsten. So the third question is this: what's been your experience of partnership working during COVID, and why is this important to you?
Well, it's important to me. At Suffolk Family Carers, we actually have over 300 partnerships running. Some of them are with schools or hospitals, GP surgeries, but the vast majority are with other voluntary sector organisations and obviously statutory organisations as well. And I know that we always deliver or work better when we're with a group, because you get that mix of knowledge and opinions and skills, and it's just a great way of working. We've always really valued it. But what's been amazing actually about COVID, and one of the good things that has come out of it, is the partnership working that's going on. There's the kind of informal side of it, which is voluntary sector leaders supporting each other, chatting, having a laugh, but also collaborating on ideas and encouraging each other to voice those ideas. You know, sometimes when it doesn't feel easy to voice an idea, if you feel you might be a lone voice, it's been absolutely fantastic having that informal partnership with others to say, no, go on, it's a useful thing to say, let's do that. So I've loved that, and I think we should do more of it. And I think a lot of people feel the same. But the formal partnerships that have happened remarkably quickly and just have been so successful. I'll give you an example of what I mean. We've been working with Ipswich Hospital. An idea that came about from Rebecca Pulford, who is a nursing director at Ipswich Hospital, especially at the time when patients weren't receiving visitors, because I understand now that's been relaxed a bit and visitors can go back in to the hospital. But in the height of what we've just been through, people were quite isolated in hospital, and if they didn't have a means of communication with family, they could have been there weeks with no support from family, no contact. They don't know how whoever's at home is, and they might not be very well either, or they might need some sort of support, or there just might be issues, and you just don't know. And even, lying in a hospital bed, some people worry about things that you would hope they wouldn't, like, did they remember to put the bins out, that sort of thing. So we've been working with Ipswich Hospital to put in place a partnership which is called At My Bedside, where we can make sure that the family is connected to the patient. The physical connection of, having the devices, the phones or whatever to connect, but also that they're able to do it, they know how to do it, when to do it. And if the patient is very poorly, they can think of different ways of doing it, like sending a video message or an e-card or something like that. And we've also been able to, at the same time, check on the family and make sure they're fine, make sure they're okay. And if they're not okay, hook them in with services or give them that emotional support, make them aware of things in their community or the home but not alone service, whatever it is that they need. Just to make sure families are okay. And interestingly, talking to Rebecca yesterday, she was saying it's been great. It's been a great partnership for COVID for this particular period, but actually it would be great anyway, because even in times when we're not in a pandemic, in normal situations, there are patients who lie in hospital and don't seem to have anybody contacting them. And if that's about family not knowing how or having the means, then what a brilliant partnership we could continue to do to help people connect. And that's just an example from Suffolk Family Carers. There are many examples from loads of different organisations that are doing stuff that just wouldn't have happened 4 months ago. So I think that's really brilliant and so important.
You're absolutely right. There is a lot happening, and I think it's when push comes to shove, you find your true friends, don't you, in terms of statutory and voluntary sector partners. Yeah. And I know the project that you were referring to and the amount of pressure it relieved from the nurses and the other staff at the hospital in the wards as well. And it's great that it addressed an immediate crisis, but there could be a long-term outcome for that as well. Fantastic to hear that. And then actually that leads us very nicely to the last question, which is what learning you think will come from the outbreak?
Well, yeah, I mean, I hope learning does come from it. That's the first thing, because wouldn't it be easy just to go back to our old ways? Very frustrating, and I hope that doesn't happen. So I think the learning for me is what you said before. I now have some idea of the reality of what it's like for carers, and I want to hold on to that, because although I really empathised before and felt I understood, it's different when you actually experience it. That inability to just get about your day as you would like to. So I'm holding on to that, and I'm hoping others do, because it's a really clear sense that we need to support people. It feels more urgent now, and I think other people feel that too. But yes, following on from the partnership conversation we've just had, there is something about doing things quickly, doing things in partnership, really making change happen, and at a reasonable pace. If somebody needs support, they need it now. They don't need it in 18 months. And I think what we've demonstrated in the past 3 months is how swiftly things can change if you want them to. Now, I understand this has been a unique situation, and that there's governance issues, and there's risk, and there's all sorts of things attached. Especially relating to statutory organisations who work in health and care, and I do appreciate all of that. But something that I've always been passionate about all my life, and very much, if I take myself back 10 or 12 years, I used to work in central government, and I used to work in a department called the Better Regulation Department. Of course, that was a utopia, it never actually happened. But the point of it was to try and reduce bureaucracy so that businesses, charities, people weren't encumbered by so much rule and regulation that you couldn't actually do anything. I think the last 3 months has shown that actually we can do away with some of it. Some bureaucracy and box ticking is purely to make people feel they're doing their job. I don't think we should be just trying to feel we're doing our job. I think we should be doing our job and doing it swiftly to support people. So I think what I take from it is we can do it differently, and we can do it quickly, and we can do it well, putting in support for people. And I want that to continue. And I'll be pressing for that anytime I get the opportunity.
It's good to have that on record now that you've said it, Kirsten. Managing risk and having governance is about an assurance process, it shouldn't be a barrier or to slow something down. And I think you've given several examples of where this is already happening, and we need to remind people that it's worked this way when it comes to it. Yeah. Thank you so much for your time, Kirsten.
Thank you. It's been really fun.